Virginia. Mr. Griffith for 5 minutes.
Thank you very much, Mr. Chairman. In 2014, the Centers for Disease Control and Prevention Advisory Committee for Immunization Practices, ACIP, updated its adult vaccine schedule to recommend that older adults get a pneumococcal vaccine in conjunction with routine influenza immunization, with a routine influenza immunization, and a follow-up pneumococcal vaccine within 6 months. When the recommendations were published, primary care physicians expressed some concern about the logistics of these recommendations and about Medicare reimbursement. Now, since that time, the Centers for Medicare and Medicaid Services announced it would cover the second pneumococcal vaccine. Dr. Chiquette, could you update us on these new recommendations and what CDC has done to work with primary care physicians on addressing their concerns and confusion?
Thank you so much. The pneumococcal conjugate vaccine that targets 13 types was recommended initially by ACIP for everybody 65 and over, in addition to the earlier polysaccharide vaccine, the 23-valent type, that we also had recommended for everybody 65 and over. The summer of 2015, we updated those recommendations to simplify them because we had heard about the confusion that primary care physicians had, and we changed them to make them simpler so that you get one pneumococcal conjugate vaccine when you turn 65 or later, and the second one a year or more later. CMS does cover 2 doses of pneumococcal vaccines, and it doesn't matter which one comes first, but we regularly recommend getting the conjugate first. It's very important for seniors who are often hospitalized and can die, and it's particularly important in influenza season because pneumococcal pneumonia frequently follows flu. So we recommend everybody 65 and over get an annual flu shot and get a pneumococcal vaccine, the conjugate one, followed a year or more later by the 23-valent polysaccharide.
Also, when ACIP makes its recommendations, does it consider how to ensure uptake is as efficient and streamlined as possible?
It's a very important part of the recommendations. We have practitioners and public health experts who are members of the ACIP, and we work closely with partners to implement the ACIP recommendations and make it easier for people to protect themselves and their families. So we work very closely with the American College of Physicians, the American Academy of Family Physicians, and so forth to really make sure that it's easy to get a vaccine and to protect yourself and your family.
Okay. According to the CDC's estimates, 4 in 10 seniors are not vaccinated for pneumonia. Meanwhile, flu vaccination rates have not significantly increased for seniors in the last 15 years. How is CDC working with the internal medicine physicians and family physicians to improve vaccination rates among seniors and ensure seniors get the recommended flu and pneumococcal vaccines when appropriate?
You know, one of the challenges with adults is that they still think vaccines are for kids, and so both providers for adults as well as adults themselves often don't recognize that vaccines can be life-saving for all of us. In addition to working with the clinical community, CDC works closely with the private sector. And, you know, everybody has seen pharmacies and chain stores really take up providing vaccines. There are now better insurance efforts that mean everybody has access to recommended vaccines with no copay, no deductible, as long as they are vaccinated in an in-network provider. And they're public insurers that cover the vaccine. The good thing for 65-year-olds and over is that Medicare coverage is very good for the pneumococcal and the flu vaccine.
Well, I appreciate those answers. Appreciate you all being here. Mr. Chairman, I appreciate you holding this hearing. And I would say that while I was not in the room, and I apologize for that, I was trying to do a couple things at the same time. I was listening to some of the testimony earlier, and I have some of the same concerns that Ms. DeGette has in regard to egg-produced vaccines. And so just note that she's not the only voice up here that is concerned about that issue.
And will the gentleman yield
the
balance of his time?
Yes.
Thank you. I have a very brief question, a follow-up question for Dr. Robinson. Can you share with me what is the status of the 2005 HHS Pandemic Preparedness Plan, and has it been updated since it was issued by the Bush administration?
Yes. Fortunately, the Department is in a very strident effort right now to update that. We expect that it will be available at the end of next summer. The entire Department, represented here and others, are actively working on that, using that pandemic plan and the national strategic plan
Go ahead,
as a
Elias.
base, and to go forward with that, and have combined a number of different efforts that have been going on for a number of years to funnel it towards that plan.
Okay, thank you. I yield back.
Yeah, Ms. Teget, I'm going to re-recognize you for follow-up.
Thank you,